Tums! They taste pretty good, but we can't eat them like they're candy because it contains calcium carbonate, which is an antacid. So the way that it works is that calcium carbonate meets the hydrochloric acid in our stomach, and it causes a chemical reaction that creates calcium chloride, carbon dioxide, and water, neutralizing the hydrochloric acid in our stomach that was causing things like gastric reflux or heartburn. So this particular brand of Tums has 1,000 milligrams of calcium carbonate in it. So that's 40% elemental calcium, 400 milligrams, and 60% carbonate, 600 milligrams of carbonate. So everyone needs elemental calcium. The average healthy adult needs roughly around 1,000 milligrams per day of elemental calcium, and we'll get it from things in our diet, like dairy products or dark leafy green vegetables, like broccoli and kale. But if you don't eat those things, you could technically supplement with a product like Tums that supplies roughly 400 milligrams of elemental calcium in that last product. And we need calcium for vital functions in things like our nervous system. So here's the end terminal of a neuron, and it has voltage-gated calcium channels that allow us to release our neurotransmitters to do vital things like committing to skeletal muscle contractions. So calcium's released from the sarcoplasmic reticulum and binds to troponin, and troponin will confirm a change that allows myosin to bind to actin, which allows us to contract our skeletal muscles. And all of this talk about calcium reminds me of my days in the emergency department, where a patient might present with cardiac arrest, and then after taking a CMP in their blood, we end up finding out that they have hyperkalemia, high potassium presence in blood, so we give them a push dose of calcium chloride to try and stabilize the cardiac muscles in the heart, because high potassium levels in the blood will depolarize that electrical activity in the heart muscles, causing the heart to stop beating. But we also want to make sure we're not supplementing with too much calcium, so menopausal women could be recommended to increase their daily intake to somewhere like 1,200, 1,500 milligrams of elemental calcium per day for the sake of their bone health. But for the average healthy adult, in exceeding this value, high concentrations of calcium in the blood could potentially be increasing your risk of developing kidney stones. So if you're supplementing with a calcium supplement, and you're potentially interested in taking a product like Tums with calcium carbonate in it, just be mindful, especially of the calcium intake in your diet. But if you want to take extra precautions when it comes to calcium in the blood and development of kidney stones, you could always eat more food with citric acid. So that's going to be your oranges, your peppers, your tomatoes, and even packets of Crystal Light contain citric acid as a preservative, as well as to give it some of that sour flavor. So hopefully this was a nice crash course in